The websites and applications that social media platforms offers for us is effortlessly enormous. However, there is growing concern about the potential association between social media addiction and mental health among university students. In our previous study, we explored relations between social media addiction and depressive symptoms. Accordingly, this study contributes and aims to assess the correlation between social media addiction and depression, anxiety, and stress amongst university students. A cross-sectional survey has been conducted with the convenience sampling of 142 pharmacy college students between 17 and 36 years. Mean age of 21.1 years, was recruited from Al Ain University in Abu Dhabi and Al Ain cities. Correlation analysis that has been revealed for social media addiction was evaluated using Beck and social media addiction scale. In addition, for depression, stress, and anxiety, assessed using validated screening tools. Data collected from the demographics examined whether demographic variables could explain the variance in addictive use and various facets of mental health. Finally, the chi-square tests were used to examine gender and educational differences to various parameters. Descriptive analyses were conducted to investigate the prevalence of behavioral addiction and mental health, examined 19 males and 123 females. 11% of them were sophomores and 86% were seniors. The average mean for students who revealed social media addiction was relatively high compared to depression and general anxiety disorder scale. Stress scale demonstrates the highest average. 64 out of 142 participants showed depression results. On the other hand, 78 were normal. Mild anxiety indicated high rate, whereas moderate stress scored the highest rates of all parameters. The correlational analysis showed a clear significant association between depression scale and engagement in the context of all of stress, social media addiction, and in particular anxiety. A direct relationship for all the parameters where the significance level is very high for all of them. Depression rate was a bit higher in males than in females and in sophomores than in seniors, with no significant difference. Anxiety level was not linked to gender. Conversely, there was an asymptotic significance in terms of educational level. As a sophomore, anxiety levels tend to be very low, but when they become seniors, severe anxiety levels start to rise 6 times. In the present graph, 47.5% of seniors suffered from mild anxiety. Being female was remarkably aligned with high levels of stress, about 8 times, with a substantial difference. Stress was not associated with educational level, as p-value was 0.81. And lastly, social media addiction scale attribute to high p-value. In conclusion, our study showed the effects of social media addiction on different aspects of mental health among Al Ain University students in UAE. Significantly adds to our understanding the extent of the effect of social media addiction on mental health, as anxiety interrelated with educational levels, especially among seniors, and stress correlated with gender, mainly among females. It is an absolute honor and delight to present our study. Thanks for everyone.